How does a chemotherapy infusion work to treat lymphoma? Imagine a treatment that travels through your bloodstream, seeking out cancer cells wherever they hide. That's exactly what chemotherapy infusion does when treating lymphoma. It involves delivering powerful drugs directly into a vein, usually through a small tube called a catheter or needle. Once in your bloodstream, these drugs circulate throughout your body, reaching lymph nodes, blood, and other tissues where lymphoma cells may be lurking. Lymphoma is a type of cancer that starts in the lymphatic system, which is part of your immune system. It involves abnormal white blood cells, often called lymphocytes, that grow uncontrollably. Because these cells spread through the blood and lymphatic vessels, systemic treatment like chemotherapy is ideal. It allows the drugs to reach and target cancer cells wherever they are, not just in one spot. The chemotherapy drugs work mainly by disrupting how cancer cells grow and divide. They damage the DNA inside these cells or interfere with the process of cell replication. When the cancer cells can't divide properly or their DNA is damaged, they die. This process helps shrink tumors and reduce the number of cancerous lymphocytes in your body. However, since chemotherapy drugs also affect some normal cells that divide quickly, like those in your hair, skin, and digestive tract, side effects can occur. To improve effectiveness and prevent the cancer from becoming resistant, doctors often give a combination of drugs. These drugs attack the cancer cells at different points in their growth cycle, making treatment more efficient. Chemotherapy is usually given in cycles. Each cycle involves administering the drugs over a period of minutes to hours, followed by a rest period. These rest periods allow healthy cells to recover. The total treatment duration can last several weeks or months, depending on the type and stage of lymphoma, as well as how your body responds. Most chemotherapy treatments for lymphoma are done on an outpatient basis, meaning you can go home after each session. Sometimes, inpatient treatment is necessary, especially if the regimen is intense or if you need close monitoring. The goal of this treatment approach is to reduce or eliminate the cancer, often leading to remission, and to prevent the lymphoma from coming back. In summary, chemotherapy infusion works by delivering potent drugs directly into the bloodstream to target and kill lymphoma cells throughout the body. It takes advantage of the fact that cancer cells grow rapidly, making them more vulnerable to these drugs. When given in cycles, often with multiple drugs, chemotherapy aims to shrink tumors, control the disease, and improve quality of life. Always remember, treatment plans are personalized, so discuss your options thoroughly with your healthcare team to understand what's best for you.